Guys, welcome to Live with Kyle and Alex, and welcome to another week of staying at home. Tonight is a brand new show, and we're so excited to have it. In fact, tonight's show is going to tell you all about this COVID-19 pandemic and what's happening in this whole situation. Um, Real quick before I pass it on to the guest here, what we're having on the show tonight. Uh, Real quick, you can text in your questions if you have questions about tonight's show to 520-329-2567. And we also have a call-in number, and that's the same number to call in if you want to call into the studio and talk with us in person. Alex, I'm passing it off to you. How's it going over there?
Hey,
Monday afternoon, Monday day.
so far so good. I am extremely excited for tonight because I, these are questions that we really need to be answered. And I think with Dr. Mark Zaetta, he is going to answer some really important questions that everybody needs to know about this pandemic and COVID-19. And hey, we want to thank you for taking your time out of your busy schedule to join us tonight and share your perspective on this COVID-19. So anyway, but first of all, thank you. And how you doing?
I'm doing great. Thanks for having me, guys. Really appreciate it.
Our pleasure. Totally our pleasure. And it's going to be the audience's pleasure because they really need to know answers to some things about it. But anyway, what is the role of you? What is your role in the patient care and management of COVID-19?
So, first of all, let me just tell you guys, I'm a primary care physician here in Tucson, which means I take care of adult folks 18 to 105 years of age. So, got a pretty wide range of patient ages. And I'd be considered a family doctor. And that's kind of my scope. So you would come to me with any questions you might have about the COVID virus or a sprained ankle or chest pain or whatever. So we're kind of a jack of all trades, but master of none. So I'm, as I said earlier, I'm not Anthony Fauci, but I'm not the clerk behind Walgreens either. So we can hopefully make it through these questions and get some meaningful, useful information, practical information that you might want to go ahead and ask your own family doctor. So that's kind of my role in patient care. I'm a primary care internal medicine physician in the community here in Tucson. So I don't do hospital medicine. I work 100% of the time right here in my office, and I see patients that walk in the front door.
All right.
How do frontline doctors stay updated on the latest information of COVID-19?
Well, we used to, and I've been doing this for a long time, we used to wait for the latest medical journal to come out. And by that time, it was already kind of dated. So New England Journal of Medicine and JAMA, these are, these are the journals that we used to read, and we still do. But by the time information is in print, it's already obsolete, especially with the new information that comes in daily with COVID-19. Everybody around the world is working on this and researching it. So there's just it's like drinking from a fire hydrant here. And so there's a few resources that I rely on. One of them, and one of the most important things I do, is participate in a weekly conference call with physicians in the Mountain West region here. So I get the latest information that's actionable and pertinent to what I do in primary care. Then there's a few websites that I go to. I think the CDC is important to look for the latest information and recommendations for my patients, and some podcasts. So there's definitely some podcasts that I think are accurate and rely on for good, useful information. So journals are probably the last thing I look at anymore. Go online and look at some valuable resources that are now really available to primary care docs just with a couple of clicks. And, as I said, that information is changing by the minute. So
Oh, I
tomorrow
bet.
morning, there'll be a new research protocol out there, or a new drug that's being tested, or new symptoms that are being looked at. And so it's important to kind of, look at the latest information, but you have to have accurate sources.
Absolutely.
Yeah. I've noticed one thing. You say you do podcasts and everything. I've noticed podcasts lately has been very popular in getting information out there along with the other technology also. But how is your office adapted to the changes in delivery of healthcare, such as telemedicine?
Yeah, so that's a great question. We've had a huge overhaul in the way we practice medicine here in the ambulatory care setting in the last 2 months. When we first started, and the pandemic hit, we kind of put the brakes on. So our office here was seeing over 200 patients a day, and healthy times. And then when the pandemic hit, we're like, wait a minute, people should be staying at home, and we have to be very careful about who's coming through the front door. And so we went from 200 patients a day to 10 or less. And we
Wow.
did that for several weeks. So while we tried to figure out the safety issues, we
Mhm.
kept our vulnerable patients at home and try to communicate with them through various platforms, such as video chat, things like FaceTime, that were secure and compliant with protecting patients' information. And then the other thing we've done is set up screeners at the front door. So before you can even walk into our clinic, you get your temperature checked. You go through a series of questions to make sure that you are not potentially infected before we let you come into our office. So we're trying to protect our staff from sick individuals, and we're also trying to keep sick individuals um, in their proper environment, which may be at home, it may be in an emergency room, maybe in the hospital. So the decision making starts before even walking to the front door, as opposed to back in the exam room now. And that's a whole different flow and process. So we've refined it, and I think we've done very well. But adopting technology is certainly a big part of that.
Oh, I bet.
Do you think COVID would change, future of medicine?
Yeah, Kyle. So this telemedicine that we're doing here has garnered a lot of interest from our patients that, especially the younger patients that are used to working with their cell phone or their computer, and they don't necessarily want to take a break in their day and come into the doctor's office. They'd rather communicate with us through a video platform. And so I think now that patients have had a taste of that, they want to continue that. So I think going down the road, I think we're going to have that as part of our daily schedule. We're going to have built right into our schedule availability to do virtual visits with our patients. And I mentioned the younger patients, but it's also important for our older patients that may have hardships in trying to get into the office because they're post-surgery, or they're so frail that walking is difficult. So if we can get those folks set up with video visits at home, that I think will be welcomed as well. It's not something we've been doing, but it's something we've had to do to adapt to our needs and see our patients, and make sure that we can continue to connect.
Wow. Okay. So also, how hard is it? How hard has it been to implement the CDC recommendations on testing and office protocols? Is that
Uh,
kind of hard to?
it was a challenge. This is all very new to us, but we've had some very good management here in our office,
Mhm,
and then resources that are outside of our office that have guided us
mhm.
and helped us implement things like the screening, the masking of our patients, the social distancing, determining when people will be tested and how they'll be tested and how they'll be handled if they're sick. It has been a process. So, we didn't figure this out overnight, but with weekly meetings and very good management who knows our patient population, our demographics, and the way things flow through our office, we figured it out. And it's taken time, but I think we've done a great job here with that.
Great.
Do you think, in your experience, how many patients that have been given bad respond emotionally? For example, are they happy with a negative result, for, like wish a positive result with helping your immunity?
Everybody has, you guys probably too, have taken a look back at your recent memory, maybe since the beginning of the year, and probably thought about an infection you had or a cold or a viral syndrome, and maybe thought, hey, maybe I had COVID, all right? Maybe I've been infected. So,
Exactly.
and they all kind of crossed their fingers saying, I hope I was infected. That means I might be immune. I may not get it, or I had it and it's over with. So we're getting a lot of questions like that. So I think people are almost hopeful that they've had the infection, and then a little disappointed when they find out they weren't. And it's a small handful of people that turn out positive. For example, I had a couple that were on a cruise ship in February, and it turned out they actually got infected. They had a very mild case of it, but they tested positive with the antibodies, and they feel bulletproof now. So I don't know if they should, but they do feel a bit reassured that they could have some immunity.
Yeah.
But we're all kind of hoping that if we get infected, we have a mild case of it and we have a durable immunity that carries us forward for several years.
To be clear, so basically, based on the evidence thus far, is it presumed that there's some immunity if you have had it before? Will you be immune to it to get it again?
It is presumed, and but it has not been necessarily proved across the board. So one thing that suggests that one is immune is that there have been protocols in place where you'll take the serum or blood of people that have been infected, spin down those important protective proteins and antibodies, and then give them to folks that are critically ill to see if they recover. So that's almost a process that proves the fact that someone that has recovered has the ability to fight off the infection. But there's all kinds of questions about what level or concentration of protein do you need to carry to be immune. So as we get older, our immunity drops. That's why some of our vaccines need to be boosted down the road, because we can't sustain a durable immunity. So I think from what I've heard is prior similar coronavirus infections may offer an immunity anywhere from 4 months to several years.
Really?
But we're all kind of standing back and waiting to figure that out. But I do think that at least, if not full protection, a significant amount of protection should be expected if you had a full-blown infection of COVID.
Okay.
What's the, I guess it depends on the, how bad you get infected, but what's the likelihood that, you can really, hit hard with this thing in your body, and what, can you have it like badly? Like, is it?
Yeah. So if we could pull up slide 3 and have everybody take a look at that.
Okay.
This is a clinical course of the disease that might be expected. So let me walk through that with you guys. So the vast majority of people that get infected have what we call mild disease. So this is disease that you would just simply stay at home, treat yourself with some over-the-counter medication, cough syrup, maybe some Tylenol, plenty of fluids. You rest, you quarantine yourself so no one else gets infected, and after 2 weeks, you're good to go. That's the vast majority of people. About 15% of people have what we call a moderate case, where you're probably going to want to be seen. You might either go ask your primary care doctor to take a listen to you, or look at your lungs, or do a chest X-ray, or you might feel unwell enough to go into the emergency room. And these are folks that have maybe a mild pneumonia or significant dehydration, or fevers they can't get under control, or they can't get out of bed. This is a harder hit.
Oh.
And then about 5% of people that get infected actually get hospitalized. They may need to go into the intensive care unit. They may need to be on a ventilator, have a mechanical breathing machine work for them. They may need IV fluids and other support.
Excuse me, you said that's about 5%?
Yeah, that's
okay.
all taken, about 5% of folks. And then
I thought it was
there's
yeah.
unfortunate 2% of people that succumb to the disease. So that's kind of how it breaks down. Now, we know that people that with more severe disease also are those people that are the least healthy or older. And so right under there, I don't know if you folks can see it, but those are the risk factors for more severe disease. So age being probably the top of the list. We're talking about folks that are 65 or older. And then if you carry a chronic medical illness like COPD, heart disease, if you're a cancer patient on chemotherapy, kidney disease, diabetics.
I'm a diabetic. How about diabetes?
Yeah, diabetes is on that list.
I was hoping you weren't going to say that, by the way.
But good control is probably important there. So
yeah, I'm under control, thank God. But I had to throw that.
I always like to point out as a public service announcement, smoking and vaping would probably put you at a higher risk.
Well, I have nothing to worry about.
Yeah.
Yeah.
And then we also know folks that carry a few extra pounds are probably more at risk as well for more serious disease. Absolutely. But if you're young and healthy and you take care of yourself, the chances are very, very low you're going to end up in the hospital.
Well, young, I'm not. Healthy, I'm bordering on healthy. So I want to ask, what are some of your patients' most frequently asked questions about COVID?
When's the vaccine coming out?
That's kind of the ultimate question there, buddy.
Yeah, so everybody wants to know when this is going to be over, and I don't have the answer to that, but that is a very common question. And then, as I mentioned earlier, folks that want to know if they were infected already. They want to get the antibody test done to see if they have less to worry about. But the vaccine question is really something that comes up almost all the time. And there's questions about travel and should I cancel my vacation plan? Should I leave the state? Should I go to California and see my grandchildren? And it's kind of case by case. If you're healthy and take the precautions, you're probably fine. But if you're on oxygen and have poorly controlled diabetes, you might want to second think that.
Right.
So do you think our future will change dramatically after this whole thing is over? Or do you think the pandemic or the disease will be here forever in our lives?
Well, if your question is, are we going to eradicate the virus? That I can't answer. There are lots of theories that it may come back as almost like a seasonal flu, and we may have to be vaccinated annually. And then, of course, we all want it to be like polio, where we develop a vaccine and it goes away completely and we never see it again. So I think that question about how long this is going to be around and how long we're going to have to deal with it is up in the air. I do think that we've all, when I say we, I'm saying that the nation has probably paid more attention to stockpiling supplies and being proactive and ready for another pandemic, which I think in many ways this one caught us off guard.
Yes.
And if you look back over the last 30 years, there has been a significant pandemic almost every decade. It just never really hit the United States, right? And this one hit us hard. And so we were just not ready for this. But going forward, I think everyone is going to probably put more resources toward being better prepared. And in that way, I think that's going to change how public health is put in place for a future.
I see.
Is there any? Well, go ahead, Alex. I don't want to cut you off.
This friend of mine wanted me to ask two questions here. He's frantically wanting to know the answer, which I'm sure other people do also. What are the first part of this is what's the accuracy of the tests? And he also wanted to know, is there another alternative to the test of the instrument going all the way 12 yards up your nose kind of a thing? He said it hurts so much.
Yeah.
Is there an alternative to that?
Well, there's lots of different questions about the test, and I, as far as the accuracy goes, we rely on the large labs here in Tucson, LabCorp and Quest. We don't do any we don't use any other source for our testing, and we rely on their accuracy. There are test kits out there that are, you'll know within a few minutes. You can self-swab. You can get a finger stick for a little drop of blood. The accuracy of those tests, in my mind, is pretty questionable, and we as an organization have not adopted those and endorsed those tests. So the tests we use go to LabCorp. The turnaround time is probably 2 to 3 days. And what we found is that those tests have been very accurate. When I'm talking about the nasopharyngeal swabs, so yeah, that foot of wire that goes up your nose and swabs, it's a little uncomfortable, but we have been impressed with the accuracy coming out of those labs that we use here. We have seen a few false positive with other tests that have been done around town at other testing centers. So I think we've kind of identified the labs that we trust, and those are the ones that we use. The other thing about the accuracy of the test is that you have to time it right. So if you don't check the patient during the right interval, you're not going to capture you're not going to get an accurate, you're not going to, if the patient is infected, you may not get a positive result. So there's a window of opportunity to test. And generally that's within the first 7 or 8 days of the infection. Yeah. So if you're beyond that and you do a nasal swab, or if you have no symptoms at all, your test is not going to be very accurate. It won't be able to detect the DNA or the RNA that we're looking for here. So we don't recommend testing folks that aren't symptomatic or outside of that 1 week time interval.
Okay.
Is there any likelihood that there will be an antiviral treatment like the flu, like with the flu?
Yeah, I think there's a lot of promise there. In fact, there are some tests, there are some medications that are already available that are being tested. Interestingly, they're antiviral medicines that have been kind of taken off the back shelf that were used for other diseases, like Ebola, and brought forward and applied to this infection. So older antivirals that weren't getting much use are now being pulled forward and manufactured and deployed for treatment of COVID and finding some footing there. So I think we're going to have hopefully an acceptable antiviral available, and I think more importantly is that vaccine.
Oh yeah, extremely. I agree. I think the world agrees with that.
Yeah.
For sure. Absolutely.
And then, what do the letters stand for in COVID, SARS, and CoV-2?
Yeah. So when this virus first came out, we just call it the coronavirus, right? Everybody was saying you get coronavirus, but that's not very accurate because there's a bunch of coronaviruses out there.
Really?
Yeah, there's probably 4 or 5 that infect humans. This is the latest mutation, the latest coronavirus. So to define it better, they named it SARS-CoV-2. That's the name of the virus. So SARS stands for Severe Adult Respiratory Syndrome, Coronavirus Type 2. So SARS-CoV-2, that's what that swab in your nose is looking for, that particular virus. There is a SARS-CoV-1 that was active about 15 years ago, and then this is this SARS-CoV-2. Now, COVID is short for coronavirus disease 19, which is the year it was discovered. And you can consider that the syndrome or the disease. All right, so that would be the infection. It's caused by the SARS-CoV-2 virus, kind of like HIV and AIDS. So HIV, human immunodeficiency virus, was the virus that caused AIDS, acquired immune deficiency syndrome. So COVID would, I'm not comparing COVID to AIDS, but I'm just saying nomenclature-wise, that would be the parallel. So that's what that all means.
Right.
Also, I think I have to say, I definitely want to say, we applaud all healthcare personnel like yourself. We really do. You guys are just amazing in what you're doing. Can you tell us how the COVID pandemic has affected you in stress and emotion from an emotional standpoint?
Personally?
Yeah.
Well, I don't worry so much about myself in this situation. I think, as I told you earlier, I think our office is well equipped to screen sick patients and protect our employees. I'm most concerned about the patients, and because I take care of an elderly population, it does give me pause to wonder about these folks circulating in the community, and whether or not it's really in their best interest to have them come into the office and see us. So every week, myself and all our providers here at the office, we look through our schedule the week to come, and we make sure that those folks we think are at highest risk don't come in or stay home. So that's kind of what keeps me awake at night, makes me worried, is that we have a vulnerable population, and I don't want to put them any more at risk than they already are. And also our office staff here too. We want to keep them healthy. And so far, knock on wood, we haven't had any positive cases in our office. So
Yeah.
Kudos
That's
to our
quite an
staff.
accomplishment. That's quite.
So Angelica wants to know why does COVID look so different in children and teens?
So I try to put this in context. So when I talked to you at the beginning, my patient population is 18 and older, and I don't have much knowledge of the pediatric population.
No.
I know the virus is very different in the way it manifests there. So I'm going to kind of back out from that question because I don't want to speak off my cuff.
No.
Great. I know what you mean.
You guys need to get a pediatrician on for your next
I know.
Yeah,
show. And
absolutely.
What is PPE and what is PPE?
So PPE, there may be a picture here of one of our staff in PPE. PPE is called personal protective equipment. And essentially what it means is protecting oneself from acquiring the virus by use of a face shield, gloves, a gown, and then a mask, of course. And there are different grades of masks, but most healthcare providers who are seeing patients one-on-one or dealing with potentially sick patients will be using an N95 mask, which is a high filtration, ultrafiltration mask. So that's PPE. And we were definitely in short supply when the virus first hit in March. So we were counting our gloves and our mask on a daily basis until we were resupplied. But fortunately, we never ran out or had to reuse.
And I'm sure everybody's figured this out. If it was media and social media and people talking about other people, but how is the disease spread? Do you know that?
Well, I think we do. I mean, the disease is spread through person-to-person contact, which means through droplets through the air, coughing, sneezing, even talking loudly will potentially spread the virus. And it can travel upwards of 6 feet if it's aerosolized or droplet form. So this is where the importance of masks come into play. So these masks that folks are wearing in public can cut down on the spread of the virus by containing the droplets and preventing them from going airborne.
How about doorknobs and things you touch? And is that also carry the virus?
Yeah. So the virus has been detected through different analysis on fomites, which are surfaces or objects that are not living, for several days, depending on the type of surface it's on. But that doesn't necessarily mean that it's a virus that you can acquire and infect yourself from. It may be there, but you'd have to have a fairly large inoculation from a fomite to be able to make yourself sick. Nonetheless, there's still a lot we don't know about this. And keeping your hands clean and disinfecting surfaces is very important because we don't know how much virus can be transmitted through touching. But mostly it's through airborne particles from others that are infected and you're in that vicinity.
Also, I want to ask something that I want to make sure of. I've heard different ways, but I thought once when I first heard about the pandemic and it first arrived, if I can say that, I thought it was a death sentence. It's not necessarily a death sentence if you get the virus. Am I correct?
Right. So, you saw on that slide earlier that the vast majority of people get over it, recover, and hopefully will be immune for some period of time after. The 2% or less of people that are dying from this are it's a minority, and typically in those high risk individuals. Now, that's not to say an otherwise healthy person can't go down, and we see this
Right.
on the news on a regular basis. But those are definitely the minority, and that is not typical.
Right.
And there are some countries like Sweden where they kind of threw caution to the wind and said, let's just protect our elderly. Let's keep them quarantined, and everybody else go about your business and get what they call herd immunity. We all, I'm not sure. I'm not seeing the latest statistics on that, but I don't think anybody else, any other countries adopted that approach. Yeah, the death sentence and the worry about if I get this, it's all over. I don't think is warranted in the vast majority of folks. So I'd like to, if any take home comes from our conversation today, is that I want to reassure people that most people do just fine.
Yeah. So also, in your opinion, I don't know if this is a good question for you, or not, but in your opinion, do you think we're opening up the country too soon, or what are your thoughts on? Is that
that's a look
touchy
question, but what I can tell you is some of the statistics that may be on one of the slides there, what we have seen in Arizona, and I can only kind of speak to Arizona,
Right.
that in the last couple of weeks, there's been a bit of a bump in our case rate. And if that, and I can only conjecture that maybe this is a result of the relaxing of the shelter at home mandate that Governor Ducey had,
Right.
or whether it was our Memorial Day weekend festivities, or whether it was Mother's Day. But it does seem to follow in the wake of those events a gradual bump up in the case rate. So I think, in my mind, an interesting statistic to follow might be the Las Vegas casinos, because they just opened up, I think, about a week ago. At a limited volume, but the cases that I saw here in Tucson all came through Las Vegas.
Oh, really?
Yeah, I saw a handful of folks, and there was some travel through a casino in Las Vegas or some connection in Las Vegas. And so I think it'll be interesting to see what that brings in cases. But we're also, I guess another thing to put in perspective is that the testing has shown 95% of people that get tested are negative. So our case rate here in the community in Arizona is only about 5%. That's a pretty low prevalence. And I it's not like New York, where New York City is 20% or higher. So 5% is not much. So there's still a lot of folks susceptible.
Yeah. Well, I didn't know the lower percentages either. I was kind of listening to the higher ones is 20% over here. It's that, and it's like,
Yeah, I mean, it's all community based, so we all have different neighborhoods and different cities, and rural Idaho will certainly not compare to Tucson. So
exactly.
I think we all have to kind of look at our community, and I think every state has their own website where you can see these statistics, and the CDC has these posted as well.
Oh, okay.
Does any medical insurance pay for all COVID-related costs for patients?
So far, we haven't had anybody receive a bill. I don't know. this is all kind of new, but we're kind of
Working at it.
assuming that these are going to get covered, because this is also good public health information as well. This is how we trace the virus.
Absolutely. And then the symptoms for COVID, hard to breathe, fever, dry cough. It all sounds exactly the same as a flu a little bit. So how can you trace it and say, oh, if you have that type of symptom, how you know if you got the flu or?
So, that's a good question, Kyle. If you could pull up slide 2, it has our COVID symptoms on there. And you're right. I mean, most viral conditions present with the top, 3 or 4 or 5 diagnoses there. So fever is almost a hallmark of this disease. So what's a fever? It would be a temperature over 100.4. And that's what we're checking at our front door. So if you have a temp over 100.4, there's a potential you have an infection. It may not be COVID. It could be influenza, although we're not in influenza season right now. So we haven't seen too many flu cases within the last month. But we would assume that a fever might represent a COVID infection. Cough and respiratory symptoms follow. More than half of the people that have COVID have those symptoms. Sore muscles are very common to any infection. If you ever had the flu, you get achy, right? So people take Tylenol or Advil because they're feeling sore. They have a headache. Fatigue also is common across the board with most viral infections. You get tired, you don't want to get out of bed. I think what's unique to this, and so, as we learn more and more about this virus, we also learn more and more about symptoms and how it presents. And we found an interesting symptom is that folks that get infected have difficulty tasting and smelling.
Really?
And this is somewhat unique to COVID. So if you lose your sense of taste or smell, that's definitely not normal. And if any of the other symptoms are associated with that, you need to get you need to call your doctor probably. There are receptors in our gut for this virus, so diarrhea, nausea, vomiting, also common. I shouldn't say common, but can be featured with the presentation of this infection. And then, of course, headache. Headache usually tracks with fever, in my opinion.
Yeah, I didn't know the taste and all of that. I'm glad I can taste. As a matter of fact, I'm using it too much. It tastes too good for me. Also, and looking back on the beginning of COVID, what would you have done different? What do you think should have been done different looking back on the beginning, if anything?
Yeah, I mean, I really think that, speaking for our office, I think that we had, I think we carried through very well, and we executed on our processes and keeping everybody safe at home and our staff. So I'm not sure I would have done anything differently. I may have paid a little more attention to what was going on overseas in February. And I think we all should. I think everybody should have probably used what was going on in China and Italy and Europe, and just assume that was coming our way, and maybe stockpiled and been a little bit more proactive. But as far as personally what we would have done differently here, I think with the guidance we had, I don't think we have too many regrets.
Okay. Is there, for people that are stuck at home?
What does social distancing?
I'm sorry. But I was just saying, for people that are stuck at home with maybe 7 or 8 people in the house and can't go outside, what are there any different, type of things that they should do with their family to help not give it to their loved ones? I mean, the reason why I say that is I was able to go to a childhood friend of mine who's has some kids, and we both seem to be okay. So I was allowed to see her children, but her children, I couldn't hug them. I couldn't hug them and kiss them, and for something to be so awful that we can't love our children. I mean, and I was thinking about the people that are stuck at home with their families and they can't really show the proper affection to their children. What is a good way to get around that? Or is there any way possible to get around that? Because that was awful to me. Not being able to love your children, you might as well leave the planet. It's about loving your children. So anyway, that gets me a little insane that you can't love the children. So is there any advice for that?
I'm not sure. That's a very difficult question to answer. Because
I thought so.
It's about the children. It's also about you, Alex. The children and the younger adults tend to be the ones that circulate the virus more. If you look at the number of new cases, it's usually in the younger population. But the people that are getting most ill are the older folks. So it's a two-way street. And I would say that anybody with young children who might be seeing that their kids are sick or have a runny nose or running a fever should definitely keep them away from others. And if you're within a house with the same folks, week after week, you can all kind of monitor each other. And if anyone gets sick, you kind of self-quarantine.
Yeah, that's true.
And hand washing is so important as well. So this is a virus, and it cannot live unless it has a host. So that's why and it's only protein. That's all it is. It's some DNA, some proteins, a little bit of fat that dissolves away with 60% alcohol, Purell, or whatever, soap and water. So just being really mindful of being sanitary and using hand washing.
Yeah, because that I don't know. It's I don't know the kids. It's just that just it's almost like you can take me out, but I gotta love my kids.
Yeah, I hear you.
What's the meaning of social distancing?
So social distancing means keeping that 6 foot perimeter around yourself. So 6 feet is about the length, probably about 2 arms length, right? You want to. That's the droplet fallout zone. That's about as far as your secretions are going to carry, and that's why 6 feet is that the zone that we consider a social distance. We do know that in drier climates, our particles tend to carry a little bit further, and in more humid environment, they'll fall to the ground. But I think 6 feet is a fair distance where you can prevent yourself, if you are infected, from infecting others.
You want to say anything else to share that we haven't really discussed already?
I just want to say that I'm very optimistic and very hopeful that we're going to have I don't want to say cure, but definitely we're going to have a vaccine, and we're going to have medication available to control this soon. And I say that just because if you look back at history, the American ingenuity, now the world is all looking at this virus, everybody is working on it 24/7. There's 150 vaccines in development right now. A few of them are going to shake out to be effective. There are drug companies working on. I mean, we've got the whole world working on it, and there are some, something is going to surface and be effective, and I'm so optimistic about that. So I trust in humankind. And we were able to get the polio vaccine out within a couple of years, and that was in 1955. So
right.
nobody gets polio anymore. So I'm very, very hopeful.
One last question, unless Alex has anything else, but with the media and everything, and people talking about how many cases, the news, what's, and I get it's bad, but do you think it's gotten totally blown out into proportion and people are just, freaking out a little bit too much about it?
I don't know. I mean, I can only speak for our community right here in Tucson. I don't want to, because we're all affected and hit differently in different parts of the country. So the anxiety level and the alarm level is different in New York City than it might be here in Tucson. I think for the most part, we're all being pretty cautious in the way we're returning to work and interacting with each other. But this is where statistics and numbers and testing become so important so that we can pull back if we need to. And I kind of think that the fall and winter is going to be a lot of stuttering and, starts and stops and maybe pulling back because there might be a little surges of infections in the community. And we really have to pay attention to our public officials and our public health systems to guide us there. So we're all learning.
Yeah, absolutely.
And we're learning all the time.
Absolutely. Yeah. Alex, you got any more questions from Mr. Dr. Zaetta?
Actually, I do have a question, and I don't know that there's an answer, but I've wanted to know, and I don't know whether you can answer, and please tell me to shut up and you can't answer whatever. But, and I won't totally understand. But as an actor, I have been approached to do a couple of films, and I guess the question is, I can't figure out how the film industry can go back to doing movies. Is there, I mean, I know you're probably not in the business of acting or movies, but do you have any advice for movie making?
Yeah, that's a good question, because actually my daughter is in that industry.
Yes.
She went to college for drama, and
all right, my kind of lady. God bless her. Tell her I salute her.
And so they're all they're scratching their heads right now trying to figure out how to do this.
I pull all of my hair out trying to figure it
out. And it's interesting, I watch certain shows, and you can now tell what's pre-COVID and post-COVID in terms of interviews and things. And so, and Broadway really is concerning, the fact that it's still dark.
Yeah, they're talking about Broadway's not coming back till like next year.
Yeah. This is insanity.
But the show must go on. So I do think somebody's going to figure this out. It might be a little different.
A lot different. Yeah, you're right.
And movies are going to be a little different than stage performances. So I think you probably have more control on a set than you might on a stage. Right. But
I guess love scenes are a thing of the past.
That's right.
I just can't see how it's going to be done. And thank God I've been in it for so long, and I'm retired now. And a couple of people want me to come out of retirement to do something for them. And I would love to do it. It's just I don't see how you're going to be able to do it.
Exactly.
Yeah,
But anyway, we shall see. You know.
we shall see. Yes. So we could maybe talk in 6 months and see where things are.
Yes. Yeah. Well, absolutely. I have to say this has been wonderful for me. I've learned quite a few things.
Good.
And yeah, and I think hopefully everyone out there watching and tweeting and calling or whatever, I hope they've learned something and it'll be up on the net to watch all the time. So really appreciate it.
You're welcome. My pleasure.
Totally extraordinarily. Thank you.
You're welcome.
Recognized and appreciated.
All
right. Friday night on Live with Kyle and Alex, we have Jared McMullen. This guy has brought life into everybody's eyes, from comedy to prank calling to live web shows. This guy's been crazy. He's the first founder of Friday Night Cranks, the first live prank call show on the web. So that's Friday night. And then Monday night, we have Crystal Stark, a local Tucson singer. She was American Idol contestant, going through Hollywood Week, etc. She'll be on Monday, and then Friday after that should be something brand new. Tune in Live with Kyle and Alex. Be sure to subscribe on YouTube. Check us out on Facebook, Twitch, and Periscope. And we'll see you on Friday, everybody.
Kyle, you say that so well.
Thank you. Appreciate it.
Thank you.